Welcome back, dear friends. We have a question for you. Does head and cervical posture correlate to malocclusion? What do you think?
Come along with us to figure it out.
Hey Ellie, I came across an interesting article titled Does head and cervical posture correlate to malocclusion? Actually, it discusses the relationship between poor posture of the head and neck and myofunctional disorders in the craniofacial region.
Based on this study, abnormal head and neck posture during a patient's active growth stage can disrupt the normal development of the craniofacial structure. This seems to be a biomechanical and anatomical connection between the neck muscles and craniofacial structure.
In fact, the article mentions that previous epidemiologic studies have shown a higher percentage of craniomandibular disorders in patients with neck problems. These disorders are often accompanied by malocclusion.
So, the hypothesis is that head and cervical posture may correlate with malocclusion. That sounds interesting. Have there been any specific findings regarding different types of malocclusion?
Yes, indeed. The article highlights some findings in relation to different types of malocclusion. For example, children with class 2 malocclusion were found to have a higher head extension upon spinal column. On the other hand, subjects with class 3 malocclusion had a significant lower cervical lordosis angle.
It suggests that alterations in craniocervical posture are closely associated with the sagittal malocclusion. So, correcting the abnormal head and cervical posture could potentially help prevent the development of the malocclusion.
Exactly, Ellie. The article mentions various conservative and physical therapies that show promise in correcting abnormal head and cervical posture. These include postural continuous monitoring, transcutaneous electrical nerve stimulation, bracing, and smart posture corrective orthoses.
It's great to hear that there are potential preventive measures available. However, I'm curious, have there been any opposing viewpoint challenging the correlation between the head and cervical posture and malocclusion?
Yes, there have been opposing viewpoints raised by some researchers. Actually, they argue that many current studies overlook the confounding effect of age, which may contribute to changes in the degree of cervical lordosis. So, they suggest that the abnormal jaw relation may be attributed to developmental disorders rather than poor cervical posture.
That's a valid concern. It's essential to address debates and gather clear evidence on the correlation between the cranial-cervical posture and malocclusion. Proper understanding of this relationship is crucial for the diagnosis, prevention, and treatment of the malocclusion in patients with abnormal craniocervical posture.
Sure, now let's sum up the information for our viewers. One more time, my dear friends, the hypothesis that head and cervical posture is correlated to malocclusion has been widely discussed in orthodontics, with the idea that correcting poor posture can prevent or treat malocclusion. However, despite some positive outcomes, there is still no consensus on this issue. And concerns have been raised about the study design compromising the reliability of conclusions.
The available information on the association between head and cervical posture with malocclusion mainly come from cephalometric measurements rather than experimental research. While different cephalometric variables are widely accepted, they provide only a limited evaluation of the complex and dynamic craniofacial and dentofacial development. Three-dimensional measurements, such as those obtained from CBCT and raster stereography, are needed to better understand the association during the developmental stage.
It's important to consider potential risk factors and sources of bias when evaluating the results. Factors like ethnicity, gender, age, and chronic disease related to changes in head and neck posture, such as respiratory disease and TMJ disturbance syndrome, should be taken into account. However, many studies did not discuss or control for these factors adequately, leading to heterogeneity and potential misinterpretation of data.
The limitation of this study include the moderate quality of the included studies, large heterogeneity observed in some variables, and the lack of subgroup analysis considering confounding factors. To address these issues, future research should aim for high-quality clinical trials and experimental studies, incorporating advanced techniques like CBCT, MRI, raster stereography, or EMG for more objective assessments. Careful subject grouping and sample size estimation are also crucial to minimize heterogeneity caused by confounding factors.
Indeed, the inclusion of non-invasive techniques and rigorous control of confounding factors in future studies will contribute to more reliable conclusions.
Sure. By addressing these limitations and incorporating advanced techniques, we can improve the quality and reliability of research on the association between the head and cervical posture and malocclusion.
And finally, to gain a better understanding of the role of head and cervical posture in sagittal malocclusion development, it should be conducted large-scale prospective studies with high methodological quality and minimal heterogeneity in the future.
Well, that's it, friends. Thanks for joining us today. Hope you learned something new.
Sure, and don't forget to join the Paper Biopsy family and never miss a moment. Goodbye.